when we finally treat COVID-19 as an endemic disease, what sort of infection numbers are likely? Because it's already spreading quite a lot today. And how many people are likely to die from it? For flu is endemic, but we still get two influenza deaths every day. We don't talk about it, so people don't react or panic. But then many people in Singapore are not vaccinated against the flu. Most of us are vaccinated against COVID-19. So will we see more deaths or fewer deaths?
Actually, Salma, this ties in with your earlier question, because when you ask us about what is the new normal and what measures will be retained, in a sense, we have been talking about the virus, but we haven't talked about what we might want to accept in terms of the cost of living with COVID-19. And that in a large part is going to determine how many cases and how many deaths that we see in the community, right? So Denmark, which has kind of fully opened up, they are experiencing hundreds, nearly 1,000 infections every day and about 6 to 7 deaths every day. Is that the number that we might be willing to accept in Singapore? Or is it closer to influenza, which is 1 to 2 deaths? Or do we want to aim for no deaths, in which case the constraints on society will be extremely high?
I think at the same time, we also think about the impact of the current restrictive measures on the long-term health, mental health, the future of our children. They're growing up in a situation where going to school is just about education. There's no play. And we know play is so important in part of growing up. Part of the benefits of university education is that you form this network that then carries you through your career. Our university students have been stuck at home for a year and a half, right? So what's that going to do to the future of our next generation, the country? I think that's the long-term price that we're going to pay if we continue restriction, right? So I think at the end of the day, there's that balance that we need to strike.
I think if we can limit the number of excess deaths from COVID-19 and as far as possible allow our society to go back to normal, meaning the education of children, the ability to travel and interact with people, that is the ideal in my mind.